Welcome to The Scoop from the Lurie Cancer Center's Adolescent and Young Adult, or AYA, Cancer Program. We bring together AYA cancer survivors and experts to answer important AYA cancer-related questions. We hope you enjoy the conversation today.
Hello, everyone. Welcome to The Scoop. Thank you so much for being here with us today. Today, we are going to talk about that time of transitioning off treatment into survivorship and how to take care of yourself in the midst of that with mental health. So we're just going to get started with a few introductions. I will start. I am Bryn Fowler, and I am the AYA Program Coordinator at both Lurie Children's and at Northwestern Medicine. Nick, do you want to go next?
Sure. My name is Nick Alio. I am on board 39 at Northwestern, also help out at Gilda's Club. I had cancer in 2013, and since then I've worked in tech and done some film producing on the side. So yeah, that's me.
Awesome. Glad to have you. And Giselle?
Hi, everybody. I'm Giselle Perez. I'm a clinical health psychologist and a scientist at Mass General Hospital and Harvard Medical School. And both my clinical research focus is really helping individuals who've been impacted by cancer, in particular adolescent and adults.
Awesome. We're so thankful to both of you for being here with us today. Giselle, we just had some questions and that we wanted to ask you, and I hope that everyone finds this conversation helpful.
Yeah, thank you for being here. So I'll kick it off with the first question. Talking about survivorship and transitioning to survivorship, I know it can be overwhelming and even intimidating. For me, getting back to work, going to that first happy hour, going to hang out with friends first time, like each one of those was a major step to get over. Almost felt like an out-of-body experience sometime. Wanted to see, what are some common things that come up in the post-treatment survivorship phase?
That's a great question, Nick. And I just have to say, I'm so glad that we're talking about this, because what happens is people don't talk about it. So as you described, that post-treatment phase is something that I've found people are not prepared for. And it's shocking because you go through the cancer experience, it's sort of chugging along. You have these expectations, these appointments that you're going through, and then suddenly it ends. It ends as abruptly as it began. But then now you're sort of left off with this what feels like a new place and a new body. So what you're describing is a period that is relatively isolating, I think. So the things that I have seen pop up are really often related to where a person is at when they're diagnosed and going through treatment. So what are the disruptions that they're facing at that time, right? So if you can think about, if you're a person who's been dating, well, how do I go back to the dating field? If I go to a bar and they're looking at me, are they looking at me, or are they looking at, the scars, or are they looking at, my hairstyle? What are they looking at? And how do I talk about the cancer experience? Do I introduce that? At what point do I talk about it? Or if you're dating, well, how much do I need to tell my boyfriend? Like, how serious can we become? I don't know if I can have children. I don't know if I want to have children. I shouldn't be thinking of having children. Nobody in my age is thinking about that. Things like how do I establish boundaries with friends and family? So as a young adult, you're becoming independent, but once you are diagnosed with cancer and go through treatment, it's like suddenly you are now dependent on others. And so there's this kind of separation that happens. And it's sort of, how do you reestablish those boundaries so that you're able to regain your independence if there's a sense of loss? How do you feel comfortable with your skin? So coping with side effects. I mean, I can go on, but these are just some of the concerns that I've seen emerge amongst many others.
Yeah, I think you articulated so well what we hear time and time again from folks transitioning off. And one of the things that we see even programmatically is that once treatment is over, you've kind of been in this like fight or flight, this intense time. And that once that stops, you're not seeing your providers as regularly. That's when we see some of the like mental health issues come up, or that's sometimes when we see people engaging in things like our support groups that they didn't engage with during treatment. And like you were touching on, people report, just feeling really isolated and overwhelmed. Do you have suggestions of kind of how to guide people who are in that place and feeling overwhelmed by what they're experiencing pop up mentally?
Yes. Ask for support. Get connected. I mean, I can't emphasize that enough, because you don't have to be alone. I think one of the things that I often emphasize to the individuals I work with is that, of course, you're feeling what you're feeling. Let's not pathologize it, right? We don't have to give it a name if you don't want to. We can call it what it is, which is, gosh, this is scary. These are challenging times, and there isn't a need to do it alone. And I think, hospitals have support. They have psychologists such as myself, and it's not that you have to have a mental health concern, but rather talking about this aspect of adjustment. How do I resume the life that I had before cancer? Identify other support networks. It's okay to be vulnerable when you're already feeling vulnerable. Seek other networks like Cancer Sucks. There's just other online networks, I think, that are available, but are not necessarily shared by providers. So I think it's just okay to communicate to your provider that you're feeling a bit unsettled and that you would like to find either someone to help talk about the adjustment concerns or to find ways to connect with others who've gone through similar experiences.
Yeah, I think that naming it is so crucial in that process. Thank you. That was really helpful.
Yeah. And I can definitely relate to all of those things. Yeah. I remember, getting done with treatment, getting done with the doctors, like, yeah, go live your life now. It's like, what do you mean? I've been coming here like every day for months. Like, what do you mean? Like, now I'm clear. Like, so yeah, definitely get what you're saying. Like, one thing I remember, just since you bring it up, is I had a hard time like convincing myself to join stuff, or convincing myself right in the beginning to reach out or to even admit that I had a problem, because it felt like, I don't know, guilty having a feeling like you got done with cancer, like you got the all clear, you should be happy, but it felt guilty admitting that things weren't all right. Like, do you see that a lot?
Yes, 100%. Again, a lot of the work that I do is validating and kind of telling people this is normal. It feels better to hear that, okay, I'm not alone. Now, guilt, I think what you're identifying, something like survivor's guilt, is quite common, especially when you are seeing people who may not have either completed treatment or for whatever given reason. And what I often say is, guilt is a wasted emotion. The reason behind that is because your experience, regardless of what it is valid, right? Whether it be, I have some people say, oh, I just went through surgery. Well, you know what? Surgery is scary. Or I just did this. I hear the I just. And I think we need to get away from the I just and call it what it is. I went through something scary. And trying to compare it to others is just not fair. It takes away from your experience. And I think what can happen is that you can be grateful and at the same time acknowledge that what you've gone through is hard. There's no need to compare. It's not a competition. So yes, we can identify survivor's guilt as being a common concern that I see individuals face pretty often, but we talk about how it's okay to be grateful. And at the same time, it's okay to acknowledge that what you've gone through is pretty hard.
Nice. It's good to hear. Yeah. That's an important thing to remember for sure. I know some other things that would come up along with that was going back to the doctor's office and the fear of recurrence and getting scans and that stuff. That was a whole other part of it that was hard to get used to. So I guess around that, what suggestions do you have for people in survivorship going through that stuff? Because it was very anxiety inducing for me.
Yes, it is for absolutely everybody. Gosh, scan anxiety is a real thing. It is a real thing. And I wish providers would talk more about it. And it's the worst because when you're in the room and you're going through the exam and then there's silence and you're there and it's silent and nobody's saying anything. You're like, what does that mean? And, have they found anything? And of course, it's a technician. So the technician can't say anything. So you're creating all of these scenarios in your mind. And it's now you're reliving the experience once again, and nothing has been shared, right? And let's not even talk about what happens as you're approaching the exam, right?
Yeah. I still, when I go back, it's been 8 years, but I still have that.
It is. And I'd love to say that it gets easier. Yeah. It gets easier with time, but it's a reality that I think people aren't prepared for. And part of what we talk about is prepare, right? That's a trigger. Anniversaries are triggers, right? The anniversary of diagnosis, the anniversary of your first treatment, the anniversary of, your final treatment. And then this first, follow-up. Every single point is a trigger, and it's preparing for those times and nurturing yourself in preparation for those times. So that would be the first thing that I would say, is just prepare so it doesn't catch you off guard, because people don't expect that as often. The next thing we talk about is just acknowledge and validate. Give yourself worry time, right? People often try to take the approach of, I'm just not going to think about it. I'm not going to think about it. I'm going to ignore it. It's not there. But guess what? It's like a bad song, right? Have you guys ever had a bad song that you just really hate, but it keeps playing?
Yeah.
Yeah, the Prey all the time.
And I'm not going to call it out, because the last time I got in trouble when I called it artist that I didn't like. So I'm not going to say what that song, but so it's like a bad song that you just don't want to hear. And it comes back with a vengeance. And it's the thing that you keep repeating in your mind. And guess what it happens? It's when your mind is silent. So when you're trying to fall asleep. So what we talk about is actually scheduling in worry time, which is, as it sounds, put aside 15, 20 minutes, make sure it's scheduled, put an alarm so that way you don't go over, and just free write. Write about your worries, let it go. It's quite cathartic. And what it does is it allows you to actually acknowledge your fears, which are valid, right? You can't ignore reality. And it also is very helpful for sleep, because once you go through your worry time, then if you're having any difficulty, if it's disrupting sleep, as it often does before a scan, then you can kind of say like, okay, I worried about that already. I already processed that, and I can do that tomorrow during my worry time. I often also encourage people, we know that mind-body practices are growing in terms of understanding, research demonstrating that it is quite effective in managing not only symptoms that people experience, but also managing these types of worries. So I encourage people to find a mind-body practice that they are willing to do and that they like. Okay. Not the traditional, like, oh, I have to meditate. I have to be like a monk and create this wonderful practice. That's not reasonable. If you don't enjoy it, you're not going to do it. So I often say, find something that you like, that you're already doing. If you like to swim, let that be your mind body practice. If you have a pet and you have, a cat that you enjoy just petting, let that be your mind body practice. So it can be whatever it is you want it to be. The difference is that you have to actually create that mental anchor. What that means is whatever you're using as your focal point, you focus on that. And every time your mind wanders to the worry, the what if, what will happen, you simply acknowledge it. You don't put yourself down, but you bring it back to your anchor. And so the way I explain it to people is like, pretend you're, I love the water. I love boats. So pretend you have a boat on, anchored to the shore. If there's enough waves, like thoughts, the boat will start moving away from the shore. However, that anchor, if strong enough, is going to pull you back. And that's how mind-body practices work. So every time your mind wanders, you just simply bring it back. So you would bring it back to petting your pet. You would bring it back to the repetition of swimming, be it walking. So I try to kind of tell people, don't worry about traditional mind-body practices and find something that works for you to help deactivate that stress response that is elicited when you're worrying. Another kind of content, and I'll give one final tool, which is kind of also recognizing unhelpful thoughts, extreme unhelpful thoughts. So being okay with coming up with the questions, identify what are the worry thoughts? What are the ones that are actually potentially less evidence driven? What can I problem solve? What can I ask my providers? And then those are the ones that you work on challenging and reframing essentially, which you would work with someone to do. Or there's the coping using the mental anchor that I described.
Gosh, I don't also want you to stop with these like concrete things that are just practical and I think really, really helpful. I've never heard anyone talk about kind of the mind body exercises kind of out of the box. And I think that's so helpful.
Yeah. And about that, like a follow up on that. So like, just make sure I got it straight. So like your pet, do you set like a timer for that? And you're like, all right, for like 15 minutes, I'm focused on petting my dog, my cat. And like, that's all my focus is going to be on. Is that like what you're saying?
That's what I'm saying. And I know it sounds like, oh God, I already do that. But think about it. Have you guys, if you think about any kind of exercise or going for a walk, have you done an exercise that you like to do or gone for a walk and you've noticed that one time it felt really good and another time it didn't feel that good?
Yeah.
So what you might find is the only distinguishing factor between the two is that time that you felt it was amazing was when you were fully in that experience, sort of what you find with mindfulness. Whereas that other time that maybe you are a bike rider, but instead you were thinking about something and you were actually paying attention. So you were not anchoring yourself to the activity. It didn't feel fulfilling or like the runner's high, right? So that's essentially what I try to describe to people when I'm trying to encourage mind-body practice, because it's this thing that we know it works. We can talk physiologically what happens, cognitively what happens. But what I've noticed is that people steer away from it because they quote unquote fail at what they think is the quote unquote way you should do it. And so when I try to work with my young adults to find ways to incorporate this practice is to say, you know what? Let's break all the rules. Let's find something that you're already doing that's easier to fit into your daily practice. But let's create this specific rule. And the only rule they're going to ask you is to actually pay attention. So let that repetition be what serves as your mental anchor. And I find that the really concrete tools are really critical, because when it comes to that aspect of worry, it's really hard to focus on just your breath. I have a lot of people who are successful with that, but it's boring. I find it boring. And if I find it boring and I'm the practitioner, well, how am I going to tell somebody else to do it? So what I do is I listen to stories. I love stories. I'm Latina. So it's like, that's just the part of my background, right? So when I practice meditation, I actually don't just focus on my breath. I actually put, a guided imagery exercise. So like I said, I love the beach. So I'm more willing to listen to somebody guide me about being on the beach. And that I can listen to, and that is my anchor. So that is what holds me to the shore while my thoughts try to carry me away.
Nice.
And then with regards to time, yes, let's not one of the first things when I was learning this years ago, my joke was, I'm originally from New York. I don't sit. I keep moving. Okay. Don't tell me to just sit and be quiet. And so I can understand that if you tell someone, okay, to make this work for you, you have to do this for 15 minutes or 20 minutes. Like that feels like a lot.
Yeah.
And if it's a lot, guess what's going to happen? You will do it, right? Mm-hmm. Or your mind wanders and then you start putting yourself down and then there goes that. So I say, let's start off with 5 minutes. Give me 5 minutes. Most people can do something small. So don't try to jump into the deep end if you don't know how to swim. Practice, get good at it. And then when you find something that you like, then see how you can expand on it.
Nice. That's really great. Very helpful.
Yeah. So thinking about all of these things that are very present in a survivor's mind that you're kind of walking us through, I think that can be what creates some of the isolation, is it's just kind of your own lived experience. But do you have any ideas or suggestions for how folks can communicate and name some of those things to friends and family members and important people in their lives so that they are involved in that process and can know and understand what they are experiencing?
Great question. This social support, so critical. And it's so many changes happen from that stage of going through treatment and then thereafter, right? You find shifts in relationships, people who are there or not there, or surprises. And this part about communication is another important component, because people want to help. And sometimes they don't necessarily help. Right? I can't tell you how many times people are like, stop asking me how I'm doing.
Yeah.
Or stop congratulating me. I didn't earn this. I didn't graduate from something. Don't It's really frustrating. And I think part of it is just really recognizing what it is that you want, what your boundaries are, what it is that you want to communicate. And this happens on many levels. So to your family, being able to identify, these are the things that I want help with, and these are the things that I need space and time to work through. Or look, if you want to celebrate the end of treatment, you can go ahead and you can do that, but I need my time, right? It's okay to say that, as long as you're explaining, just that this is what I need for this reason. It's more of like the I statements. Like, I see that this is important for you. I appreciate that. I understand. And at the same time, this is what I need from me. So you can't control how other people, what they do or what they say, but what you do have control over is what you want and what you're willing to share. So find out what it is that you need to communicate and be okay communicating it, because in the end, they want to help. And the more information you give them, the more able they'll actually be to help you.
That's pretty great. I wish I would have done that before my last treatment. I still remember my dad pulled up to pick me up with balloons and all kinds of stuff. And like, I mean, that was the moment I felt physically worse than any time in my life. I was like, I am not in a mood to celebrate. All I want to do is sleep. He was like, what? I was like, I wish I would have said that ahead of time.
And it's just because nobody knows. And this is even with that case, I've had individuals who are like, they don't ask me about, or they when I tell them about my fears, they tell me, I'm fine. You're fine. You're fine. Yeah. And gosh, how much more isolating can that be? It's like, yes, I know I'm fine. And at the same time, I'm freaking out, and I just need you to hear me.
Yeah.
Don't problem solve. Like, I know I'm smart. I have my doctors. I trust my team, but just listen. That's all I need, because I'm in my head and I don't want to be in my head. Mm-hmm. And so what happens is that people are scared by cancer. And so they're scared. They know what you've gone through. And now they're like, okay, we're done. We can put that to the side. They don't know. They don't have to move on with what you're left with. Yeah. And that's something that sometimes we feel like we have to take care of them. But you know what? We have to take care of ourselves too.
Mm-hmm. Yeah, I definitely agree. I remember people, I loved when I get phone calls and they'd ask me how I'm doing it. I'd be really honest with a few people. And then I loved at the end when they'd be like, oh, that sucks. Thank you. That's all I wanted. Yeah. You didn't have to tell me how to make it better. That's all I wanted.
It's like, it's not pity. We don't want pity, right?
Right.
It's just like, okay, that sucks. It's like, I would, I almost like in the same way of somebody saying like, I got my tire, I broke up with, I don't know. It's a different kind of just acknowledge, just validate. Don't worry about trying to put a Band-Aid on it. Don't worry about congratulating. Just listen and say that sucks, because that's what it is. Yeah. And then listen to me when we move on. It's like, okay, I'm done with that. I don't need to keep talking about it.
Yeah.
I think it's so important to remind ourselves that it's okay to share those things with people, because I think maybe it's my personality too, but it can be hard to know those things and to share them with loved ones who, you're worried about. I don't want to offend them or step on their toes, but it is so powerful when you can share those things and have it improve, the way you're reacting if they know what your expectations and your desires are there.
Exactly. And they want to help. That's the thing. They want to help, but they don't necessarily help in the way that we need. And so it's really sort of giving them an instructional guide, like, this is how you can help. And while it might seem, as you say, it's like, oh, I don't want to hurt them, you can find a way to say it in a way that they can hear it and they will feel helpful. So it really is a win-win.
And then for those loved ones and friends and family, like what advice do you have for them? It sounds like maybe just listen, or what do you think?
Yes. Just listen. Just listen. Don't try to fix it. Don't congratulate. Like, listen, follow the lead. The person will tell you, hopefully, especially, will feel confident. Just hear what they have to say, even if it's hard, because sometimes it will be hard, especially if it depends on who it is that's listening, right? I've had partners who have difficulty hearing it because they're scared, right? This aspect of being a caregiver as a spouse or as a significant other, you go through your own fears and sort of you have these role changes that you're kind of adjusting to. So it does a number, but part of it is just like understanding that this is a significant event in someone's life. And sometimes they just have to cope with it and process it in their own way. So sometimes it's just listen, don't label, don't make them feel bad. Don't try to make them move along quicker, because it's just an aspect of time.
Mm-hmm. I think it's also important in a conversation about these caregivers that oftentimes caregivers have their own things that they need to, work through, and that they may need to seek out some help too, that all their experience is very different than, the patient, the survivor, that they still have needs and concerns that are valid.
Yes, Brent, such an important point. I mean, there's a lot more research going on in terms of the impact that cancer has on caregivers. And when I use the term caregivers, it really encompasses that into all aspect, right? So you can talk about caregivers as parents, as even siblings, depending on what role, when it was that it happened, spouses. So we know that it's a significant impact on these individuals, and oftentimes I actually encourage them to also get support, not because there's something wrong with them, but rather because how can it not impact you? How can it not?
Yeah.
Right? If you fall and you get a big gash wound, like, is it not going to hurt? It's going to hurt. So why are we going to say like, oh, well, now you're this because no, let's call it what it is.
Mm-hmm.
It hurts.
Yeah. Yeah. Wow. So much that happens for everyone involved in this process. Do you find it common for folks kind of emerging off of treatment to come out with different emphasis on different values or kind of their outlook on life?
Yes. Oh, that's another, we kind of work towards that in terms of the topics that we talk about. My kind of, what I often tell people is that, they come to me and they ask me, well, have I changed? Who am I? This component of identity development, because that's really what's disrupted when you're going through cancer treatment. And we talk about how every life experience brings about a change in you, a part of you, right? And a change in values. And it's defined by a life experience. So be it that first date, or when you ask someone to get married, or when you get married, or when you have a child, graduating from high school, graduating from college, like everything informs your life and sort of cues you in on what matters. And that's what happens with cancer. So who you are as a person at the core doesn't change, but the things that matter to you might. And so part of our work, especially with this aspect of who am I after cancer, is figuring out what those things are, right? Mm-hmm. So what are the values that you think you have? Maybe before it was work, and then it was, nutrition, and then it was exercise, and then later on it was family. Maybe after all of this, it's health, then family, then, whatever, you have a sense of what I'm saying. But then what happens is once you identify what your values are, then we talk about how important it is to figure out, are you doing, now that your values have changed, if they've changed, are you taking steps in the direction of your values? Because what happens often is that we fight so hard to go back to who we thought we were, that we're fulfilling values that are no longer our priority. And so that's why we feel like there's a gap. There's something that's missing. So once you can reorganize and re-identify your values, then you can think about, what am I doing that's moving me forward in that? Mm-hmm. But accepting that it's okay for values to change, because that's going to happen as we go through life.
Interesting. I remember going through that, and I remember, like, it seems even as I got further out into the survivorship thing, like it shifted a little bit even more. Is that pretty common as well?
Yes, absolutely. Because it's sort of kind of, as you're going through your experiences, you're just kind of changing the way you're understanding the world. And so you're just growing again, in a sense. You're redefining yourself. And what I see it as is that sort of, as your values are sort of fluctuating, right, or changing, things that matter, change in terms of priority, what happens is I see it as identity fusion, right? So you have the before cancer self, and then you have what you've been learning more about as in terms of your post cancer self, and then you're sort of bringing the two, making sense of the two.
That can be tough too. Yeah, that's cool though to think about it that way.
It is it's hard.
I guess another hard thing you kind of touched on earlier, would love to think about ways to approach it, is that survivor's guilt. I know that was, I think about like some of the harder things, that one would really, really stuck around. Like values are changing, like all that's going on at the same time. It's like, whoa, like, why do I feel bad? Even though I'm past this, I'm done. A good thing happened. Why do I feel bad now? Like that. Personally, the year after treatment and everything was almost pretty much mentally harder for me than even going through a lot of the treatment.
Yes, and I want to say that that's usually the case. People are shocked. It is that after treatment period that is often the hardest. In that situation, that's when I would encourage meeting with someone to help sort of process, work through what it is that you're thinking about, right? Because this aspect, because there's survivor's guilt, sort of this aspect of comparison, but also feeling badly for not feeling great, right? What you're describing is a little bit different. It's more about like, okay, I'm fine. Why am I feeling so badly? Mm-hmm. And my answer to you in that sense is, how can you not, right? You just went through the ringer. And so setting your expectation that you should be happy is sort of saying like, oh, well, I just got super into this big car accident and I should be happy because I walked out of it, but my car and everything is destroyed and I have my leg that's broken and, I can't do this, but I should be happy. Yeah. Well, no, that just doesn't make sense. Right. So in that situation, it's being able to take a step back and ask yourself, what is it that what are you telling yourself? What is it? Why is it wrong to say, okay, this was hard? What is it that what are your expectations? Where do you think you should be? And why do you think you should be there? What is it that, you're finding is missing? And what are your needs right now? And I would encourage actually working with a provider such as myself to kind of process all those life changes in the way that we've discussed.
Got it. Yeah.
But I start off by validating it because, again, as I said, Nick, I do find that people experience more challenges after treatment ends than during.
So glad you say that, because I feel like that needs to get talked about, put on billboards, and said more often.
Yeah, to normalize that experience. Totally. To wrap up our interview, we had some questions that were submitted from AYs in our community, and we'll just ask two of those. So I'll read this first one. Is it normal to feel like you owe something to all of the people who supported you and were loyal during your treatment process? How can I ever repay all of them? This includes friends, employers, doctors, nurses, other healthcare professionals for their incredible support and help.
So is it normal? Yes. All these things. I wish I'm like, I want to put it on a billboard. Like what you are experiencing is normal. It is exactly what we see. Yes. It's normal to feel that way. You don't owe anybody anything. You don't, right? And I ask because think about if it were flipped, if the situation were flipped and somebody you loved and cared about was going through something like this, what would you do? So why would it be so outlandish to think that somebody want to do the same for you, right? You would be pulled to help. In the same way, if you were a provider, well, providers are in this for helping. I mean, I can't tell you how much I love working with me. Like this is what keeps me going. Just knowing that seeing that sense of relief when I say, you know what, it's okay. Like what you're experiencing is normal. Just that is enough to make a person feel less alone. So in terms of owing, like it's normal that you feel that way, but don't feel that you owe them. You can give back though. And actually there's a lot of research to show that aspect of giving back also leads to a sense of fulfillment. So I often say, get involved. And we see a lot of our young adults getting involved. How that looks might differ based on where you are and what you're interested in doing. So if your hospital has a adolescent young adult program, which I would love hospitals to have, serve as a peer mentor. Actually, I work with a young adult stakeholder board because my emphasis is how do we change things? How do we make things better? And that's something that's been identified. It's like, I wish there was someone who's gone through this who can tell me what I might be able to expect. So I get it. So I can ask them questions. So serve as a peer mentor, be that individual who can help the other person who's going through this experience. If it doesn't exist in your clinic, create one. Just advocate for there needing to be a space for young adults because you're not a child and you're not quite an adult. There is a need for something in between. And it's sort of this living in between is just so difficult. Participate in research. As I said, I'm a researcher, and it's not like working with guinea pigs. I am invested in making people's lives better, young adults' lives better. I want not only to help improve their emotional health, but also their physical health, because we know that there's that connection between the mind and the body. And so we want research to get better, but in order for research to progress, we need participants. So find ways to give back. Ask the providers, like, do you know any research that's ongoing into young adults? Can you connect me to those? So that's a way that you're giving back, not only to your providers. Some of the providers that you might be working with are probably engaged in research, such as myself. So help them by kind of saying, I want to help in some way, serve as a peer mentor. And these are different ways that you can help sort of individuals in your circle.
Thank you.
Nice. That's where I remember I made a mistake of, I think I got like a Starbucks gift card for a provider and she was like, no, actually I can't accept that. There's like a rule against. I was like, oh, all right. Yeah, no. And they understand. And they just, thank you.
a thank you goes so far. Like, thank you so much is something that it resonates for me. I appreciate it every time I hear it.
That's good. Good to know. So we got one more question from the community. And I think you kind of touched on this, but how do you stay grounded in what is present? How do you set different, better boundaries for yourself and stick to them regarding relationships, capabilities, whether that be personal, professional, and overall happiness? I think you kind of touched a little bit on how to, you should be setting boundaries. Like, do you have any, you've given amazing concrete examples on things to do. Do you have any thoughts on how to approach those things?
I mean, for fear of being redundant, because I think it's pretty much a lot of what we've discussed already. And I'm an advocate for writing things down, especially difficult topics. So when it comes to that aspect of establishing boundaries, sometimes I encourage people to investigate, well, what are their concerns with setting boundaries? So I'm afraid they're going to, think I'm mean, or I don't know, but you can think about what are the things that might get in the way. Like, what is it that you want to say to Joe? Okay. I want to say X, Y, and Z. Okay. What is getting in the way of you saying X, Y, and Z to Joe? And that's when you start writing down all the things that worry you. And then you start piece by piece actually challenging each of those. Like, okay, does this make sense? He's going to hate me. Well, is he really going to hate you? If Joe cares about you, is he going to hate you because you say X, Y, and Z? Does that make sense? So it's going piece by piece and actually looking at each of your worries. And sort of, I often say, put your thoughts on trial. Like, how accurate would that stand? Is it emotionally kind of reasoned, or is it something that's like valid? So that's when it comes to establishing boundaries. That's sort of one of the ways that we approach it, is just trying to understand what is it that you want to communicate, what gets in the way, and how can you communicate? So how can you tell Joe what you need in a way that Joe can hear it? Okay. There was another piece about staying grounded. So we talked about different techniques that you can use to stay grounded in the moment. And then lastly, I think you said happiness. People ask me, like, how do I, if I had the solution of happiness?
That's a big one. Yeah.
I think I would, if I had that answer, I'd like be a millionaire. My approach, it's a funny one. I often tell people, let's find balance, right? Because if you try to say happiness, well, emotions are valid. Emotions are indicators. We can't run away from them. We can just learn from them. So invite them in, understand what they are. When you feel sadness, investigate. Why am I feeling sad? If you feel anger, why am I feeling anger? Pushing it away is neglecting sort of an indicator. And it's preventing you from actually doing something to help. And so just because you have these emotions doesn't mean that they have to be in the driver's seat. They're just they could be a passenger. And the reason I say that is because when we try to strive for happiness, we sometimes think that it's the absence of sadness. And so what I try to work with people is to understand, how can we achieve balance? How can we achieve moments where we're living in fulfillment of the things that matter to us, doing the things that are of import, are valuable, and being able to be in the moment, so that when things happen that are stressful or challenging, we can also leave room for them, acknowledge them, but not let it overwhelm us. So that it's sort of like, okay, we're going to have moments when we're having a tough time. We're going to have moments when we're excited, but it's okay. It doesn't have to be excitement all the time, because it's a lot of pressure.
Yeah.
So that's what I advocate. Happiness is like, that's pressure. It's like I have to be Miss Positive all the time. So how about we reframe it as, how do we achieve balance? Mm-hmm. That's how I address that.
I love that. That's great.
Gosh, I could just keep chatting with both of you all night, but I want to wrap things up here and just thank you both. Nick, thank you for sharing your experience and what this has looked like for you. And Giselle, thank you for all of your wisdom. I'm going to be listening to this on repeat because I know there are things I missed this first go around, but just really practical nuggets and tips. So thank you. And we look forward to talking again.
Yeah, thank you so.
Thank you both.
Thank you so much for joining us today on The Scoop. We hope you enjoyed our conversation and learned something new. If you want to hear more of these in the future, make sure you like our page at Lurie AYA. We hope you have a happy day.